Barb here, Ask the PA. Well, we're deep into this coronavirus and there's no turning back. There's been so much publicity about it because it started in another country. And this is all my opinion. And it is now a pandemic, meaning that it has hit many, many, many countries all around the world. People are scared because they've never seen it before. And people are also scared because we don't know a whole lot about it. But each day, with the World Health Organization sharing information, we're learning more and more and more. The media has been all over this thing. And as we all know, that's fine, well, and good. But a lot of times the media will just continue to just provide information that may not be necessarily the most accurate, the most mindful, and sometimes there's panic. So what's going on is that it's hit this country, and in Arizona, for example, there's 9 official cases. Okay, 9, as of what I heard last night. Many offices are allowing their workers to work from home. Spring training was canceled. Many events, as you know, March Madness is still going to be played, but with no spectators. The reason a lot of this is happening is because, again, there's things we don't know. And hospitals already are feeling the pinch from flu and people with chronic conditions, and there's only so many ICU beds, and there's only so much room in hospitals. What's going on, in my understanding, in Seattle is that they're starting to build tents for overflow. And what happens in the hospital sometimes is that they have this thing called the fast track, and what happens is patients that aren't as sick, they go through the fast track, they stay away from the real sick patients and things like that. So almost like, think of it as like a MASH triage kind of thing, which they did, during wars and things like that. Our country isn't used to anything like this. We haven't had this kind of scare in decades, to this magnitude, okay? So now here we are, people are working from home, all these events are being canceled, and it's actually a way to try to stop this virus in its tracks. Imagine if you were at, like, let's say a big event, and there's 30,000 people there at a rock concert, and let's say Corona is there, and let's say a few thousand people end up getting it. The problem is, of those few thousand, many people will think they just had a cold. But there's that percentage that have things like asthma, they have heart conditions, they have diabetes, they get the coronavirus. They could get the coronavirus on top of a flu. They could get it on top of strep and flu. They're going to get really sick. And so all these people are going to go to the hospital, and the hospital only has so much room. And so if you had that kind of event happen, the hospitals aren't going to be able to handle it. So by isolating people a little bit, by allowing them to work at home, by canceling these huge events for a couple weeks, for a few months. Hey, I just had a medical legal event canceled. And I was excited about that. That was the first week of May. Also, our conference for the PAs were canceled, our state conference, and, waiting to hear about the national conference. So putting it into perspective, because we're trying to avoid a huge outbreak, few people here and there we can handle, but the hospitals can't handle hundreds of people coming at one time that actually need hospital admissions. That's the key. So I think we're approaching it as best as we can with what we know. I am hoping that what's going to happen is we're going to learn a lot from this so that we'll have protocols in place for the future. And that if something else happens, which unfortunately, guys, it's going to, something else is going to happen. It's just the way it is. So in the meantime, number 1, please don't panic. Number 2, be mindful, common sense. If you're not feeling well, stay home. If you're sick, reach out to your healthcare provider. Let them steer the show on what needs to happen. Another thing, coronavirus hits, it still means flu is out there, strep is out there. We can test for those things. We have specific treatments for those things. With corona, we're going to treat the symptoms, we're going to get you through it, and if you're having breathing problems, you're having distress, you're the person who needs to get to the hospital and get care. It's going to be okay. Each day, we take it one day at a time. This is where we all help each other out. I hope everybody has a good day. I'm at work, gonna go answer some phone calls and some emails, but just know that Ask the PA is there for you. If you have any questions, go to askthepa.com or my Facebook page. I'm all about information, advocacy, and trying to be your support. Take care and have a great day. Bye.